We will be using the hand mic. Thank you very much, Justin. That was indeed a very informative and rich presentation. Thank you for your speakers. Before actually I hand it over to Dr. Saswan Al-Majali, please take a moment and scan the QR code that they are on your tables. We would appreciate your feedback, your evaluation so far. So let's take just a couple of minutes, and then I'm going to introduce Her Excellency Dr. Saswan Majali in a more proper way and her keynote address.
Bismillah ar-Rahman ar-Rahim. Good afternoon, everybody. And I'm so happy to see that there are still remaining people here at the end of the symposium, because usually people, first of all, when they have lunch, they get sleepy, or it dwindles down the excitement to the end of the conference, and you lose interest. So I'm happy that you're here with us today. I was asked to talk about a vision for maternal and young child nutrition in Jordan. And for us to have a vision, we need to know the situation. And I think for the past 2 days, that's what you have been doing, is talking about various aspects of the status of the nutrition of women and children in Jordan. So I'll just have a few slides that will summarize what has been said maybe and what's in the literature, and then we'll talk about the topic that I've been asked to talk about. So in terms of breastfeeding, I mean, you've heard several presentations about breastfeeding, and we just want to reiterate that, sadly to say, though there is breastfeeding, and that the majority of Jordanian children do get breastfed, the problem is the prevalence of exclusive breastfeeding during the first 6 months of life is only 26%. And so even the numbers that Dr. Suhaila was talking about in the refugee camps, this is much less. This rate of exclusive breastfeeding is much lower than the global average, which is 44%. Imagine that. And the same is true for the Eastern Mediterranean region, and also true for the World Health Assembly, which is 50%, the goal of 50% exclusive breastfeeding by 2025. So we are really falling short in terms of breastfeeding. Exclusive breastfeeding, again, that is an issue. And as you can see that although we've had a stable trend of exclusive breastfeeding, that has stayed the same over 15 years. So imagine all the investment in all these programs and so on to improve nutrition, to improve breastfeeding, and yet it has remained stable over 15 years. But it has shown that there's decreased rates of continued breastfeeding throughout the child's second year of life, and the increased proportion of formula-fed infants. And you know that in Islam, إرضاع حولين كاملين, يعني 2 years, we're asked by our religion to do that, and yet even that we're not abiding by, or the global or international kinds of protocols. So this poor adherence to the WHO infant feeding recommendations and even our religious recommendations, we are expecting to have a lot of negative effects on the burden of disease in Jordan. So as you can see from this slide, it shows the differences between the topics or the areas that are related to breastfeeding. You can see it shows in the green the exclusive breastfeeding, and as you can see, it is very stable since 2002. We also have the early initiation of breastfeeding within 1 hour of the birth of the child. And as you can see, although it was stable for a while, it dropped and then it went up, but it's still falling short. The ever breastfed between 0 and 23 months, and that is the gray. So you can see it is very consistent. And with the yellow, the continued breastfeeding, 12 to 23 months, and it has also remained fairly stable. And the formula consumption, which is less than 5 months, and as you can see, it's in the blue, and it's gone up It went down, it dipped down, and then went up. Now, another issue that follows also breastfeeding is talking about nutrition for children and for adults, and specifically women. So as you can see in this slide, it shows the percentage of stunting, wasting, and underweight among children under 5 in Jordan, based on national surveys that were held in 1990, 1997, 2002, 2009, and 2012. So you can see what kind of trends we have, and as you can see, although there's a drop in stunting, but there has been some increase in the other aspects which are related to wasting, slight drops from 1990, but again, it has gone up since 2009. And the same with underweight, although it dropped up to 2009, but then it has gone up again. So what we saw is fluctuation, we're not consistent in how things are happening. If we look at anemia, and that's another aspect of malnutrition, we can see also that there's an overall prevalence of anemia between children aged 6 to 59 months, and it was reported at 32%. And again, when we had a project with Save the Children Jordan, and we were saving children and women all over Jordan, there were very similar kinds of numbers that were coming out. Most anemic children, 21%, have mild anemia, which is better than having moderate or severe anemia, but that could follow, especially what we've been hearing about the effects of the Ukraine war, poverty, the political climate all around us, and what it might have effect on nutrition. When compared to earlier national studies, there's a prevalence of anemia has been stable, 34% for 7 years between 2002 and 2009. Then there was a decrease from to 32% in 2012 and 2017 to 18. We hope now with the new survey that is going to be carried out this year that we hope to see better results, but we don't know what will happen because we have the effects of COVID, employment and poverty, etc. Now, data has been modeled at looking at anemia among children aged 6 to 59, and again, it shows a lot of fluctuation. It shows a starting decrease trend from 32.6 anemia in 2000 to 30.4% in 2010, and then followed by an increase to reach up to 32.7. So there is an increase in anemia among children. Anemia in women of reproductive age. And as you can see here, also we go back to the Jordanian Population and Family Health Survey, that the last one was done in 2017, 2018. It shows an overall prevalence of anemia among women 15 to 49, the reproductive age. It was 43%. It's quite an alarming number that it's nearly getting to 50% of women in reproductive age are anemic. That's really very alarming. Mild and moderate anemia were found in 36% and 6% of the women. And again, the modeling shows that there's a trend that started out in 2002 at 26% and has steadily been rising. Also, among non-pregnant women, so if we want to blame the pregnancy on the anemia, non-pregnant women also, it shows that there is a prevalence of shortage or deficiencies in iron deficiency, anemia, and iron deficiency anemia, and you can see the anemia is at 30.6, the iron deficiency anemia at 35.1, and the iron, that there is clear iron deficiency anemia among these women. There's a word missing. Okay, so we're talking about malnutrition, Now, and we talked about anemia and so on. If we look at the other side, which is also malnutrition, but it is overweight and obesity. And as you can see among children, there is a prevalence of overweight and obesity. In 2012, the rates were for boys higher than females, and as you can see, it was 4.7, boys 5.6, and for the girls 3.8. Now, again, there's fluctuations. So again, there is no specific trend, but it is showing that there is an escalation in overweight and obesity among children. Now, between the ages of 6 to 17, again, there is also a prevalence of overweight. It is about 17.3%, and obesity, it is about 15.7%. With overweight, it is more prevalent among females than males, and obesity in males is more frequent than females for this age group. And as you can see that according to the model data, the prevalence of overweight and obesity among 5 to 19-year-olds showed an increasing trend. So far we have alarms on all the data we're looking at, whether it's breastfeeding, whether it's anemia, or whether it is overweight and obesity. And as you can see, the trend is just going up in terms of overweight and obesity for children under the ages of 5 years old. Now let's look at adults. We looked at newborns, we looked at children. Now we're looking at adults, and in adults, again, there is a prevalence of overweight and obesity of about 60.8%, and maybe I am one of them as well. So it is an issue among Jordanians, and it is an alarming issue because of all the chronic diseases that could develop based on this. And as you can see, 29% among males, and females it's 28%, so they are very similar. If we look at obesity, we find that it is 32.1%, and it is more common among females than among males. But if we look at again, we're saying there's fluctuation, and it is expected to go up to 75%. So we know there's a problem, and yet how much are we handling it? And the predictions are it is going to get worse. So, global nutrition targets were developed by the World Health Assembly and adopted by them. And these are the targets for 2025. And as you can see, they have a 40% reduction in the number of children under 5 who are stunted. And that's something we talked about. Maybe it is not as bad in Jordan, but it is an issue. 50% reduction in anemia in women in reproductive age. And we said that is very high, it's nearly 50%. 30% reduction in low birth weight. And no increase in child overweight, and increase in the rate of exclusive breastfeeding in the first month of life, and reduce and maintain childhood wasting. So all these points, we have committed to achieve them. But how much really have we done? So we come to the title of this presentation or this talk, and it's talking about vision. And when we talk about a vision, usually in our mind, we see a positive image. You don't think of a vision as something bad. Usually it is something positive. You look at something forward. You don't look at backwards. It's something as you want to move forward. It's an inspiration. When we say vision, it means it makes people feel inspired. They want to do something. They want to move forward. They are energized. Common aspiration. That means we all are here attending this because we want to improve the health and nutrition of women and children in Jordan, and maybe other countries as well. It requires imagination. So a vision is not something concrete in our hands. If we work and get to it, then it becomes concrete. But at the present time, it requires imagination. How can I do things better? How can I do things more efficiently? How can I do things in a participatory fashion, and so on? It requires passion, because if we don't believe in it and we don't have the drive to do it, we're not going to get there. And it is challenging. It's not easy. Yes, if a vision is positive and so on, but how easy is it? And it has a lofty purpose. أهلا وسهلا دكتور. And I liked this image from one of our chief of party, the road to our vision. A lot of times, because we are saying it's lofty, it is positive, you know, we are doing it for a good reason and so on, but the road is not that easy. It is not straight. And we all know that from our work. And as you can see, it is full of bumps, obstacles, hills and valleys. And sometimes the road is lonely. Sometimes you're feeling you are alone. Nobody's understanding you. Nobody is listening to you. Why are you wasting your time doing this? And it's a learning journey, because as you're going along, trying to do something you think is right, you have to pick up things on the way and you learn whether what you're doing is right or wrong, people are happy or not, is it working? And it is difficult, you discover it's difficult to accomplish alone. You can't do it on your own. إيد واحدة ما بتزقف. It needs people, it needs equipment, it needs finances, and it majorly needs a belief that there is a destination or an end. If you don't feel that you're going to go somewhere and get to that destination, you really won't put much effort into it. So what is our vision for maternal and young child nutrition in Jordan? What is the vision we want to create and reach for women and children in Jordan? So if we're saying we want a vision, so what is that picture we want to draw? So if you draw a picture, then people can think, yeah, this is what I want to get to. So the first thing that I thought of was that I want to see young, healthy men and women form families. If they are both healthy, we hope that their products will be healthy. The other thing is that they will have healthy planned pregnancy or pregnancies. So if they are healthy and if they plan things right, their pregnancies will be planned, whether it's one or several, it's up to them. Uneventful delivery. I didn't want to say normal delivery, because what is normal? So I said that it is not going to have tragedies in it, or bleeding, or end up in an abortion, or end up with a baby being stillborn, etc. Healthy growth and development of a baby that's born into this family, and a healthy child, adolescent, and an adult, and even healthy aging. That's what I thought would be the vision. So let's take each picture of this big vision and look at it. So for us to have a healthy young couple, they need to have a balanced diet, balanced, healthy diet. They need to be mentally healthy, and they need to be physically active. That's something we Jordanians are not good at doing. And they need to be economically active. And why is that? Because they need to be able to purchase the services, to get healthy food, to get healthy healthcare, to have better education, and so on. And a support system, because as we said, the journey of life, you cannot do it alone. You need your family to support you, your community to support you, and your government to support you. And something we really don't do, annual checkups, to make us know, or we need to know whether we are healthy. And if we're anything, we can discover it early and intervene early. And that, again, is not a Jordanian way of doing things. We go to the doctor when we are sick. We don't go to them to keep us healthy. And that mentality we have to work on and change. And we need to plan the size of our family. This has to be a discussion between the couple, and they need to decide how many children they would like to have and the space between the children so that they are able to achieve their life goals and to have a better kind of marriage. So moving on, so this couple gets pregnant. And again, we go back to the woman having a healthy pregnancy with her husband beside her, having a balanced diet, having the proper antenatal care, and having mental health, not being worrying about how her pregnancy will come out, how will she look after, who will bring the income into the family, and so on. She has to be physically active. She has to have enough adequate sleep, a support system, again, that is important, and to be prepared for delivering a baby and becoming a future parent, which, again, is something we do not do. And that's why we have problems in the delivery rooms where suddenly she's having these pains and shrieking and shouting, and maybe the provider doesn't understand how to support her and why is she not behaving properly. It's because I didn't prepare her properly, either for the pregnancy or for having a baby or becoming a future mother. And that's why we see, or a father, and that's why we see a lot of, for instance, issue with family violence. Okay, so now we've had this uneventful delivery. We hope it's a healthy delivery. It is under medical supervision by qualified people who are caring and who are respectful. And that's why we hear about respectful care. So it's not just you doing the tasks, but really caring about your client and empathizing with them and showing them that you care. And bonding with your baby. How much do we care about getting the mother to bond with her baby and to start breastfeeding, as we said, in the first hour of having her baby? So now this baby is there. We need to make sure that they are growing and developing properly. So they have to have these annual checkups. They need to have their vaccines. And we need to breastfeed them exclusively. And we need to properly parent them. And that's a skill that is not easy. We think we will do what our parents did to us, and that's not right. We have to parent our children for the future and not parent them for the past. And a lot of times people say, well, that worked. My father used to hit me, and look at me. Look at how I am. That doesn't work anymore. So we need to help parents become good parents. And UNICEF had a very good parenting program, and I wish they support, reactivating it again. Okay, healthy adolescent, healthy child, adolescent, and adult, and aging. So again, if we provide them with good education, with proper nutrition, they have healthy relationships between themselves, they are physically active, and they are mentally healthy, and they are socially active, and they have the proper systems, then they will be growing and developing in a healthy manner. Okay, so for us to do all those beautiful things and to have all that vision, what do we need? Number one, legislation, and that's something you talked about. Is legislation supporting all these beautiful pictures and visions? After that, we need strategies and plans in place, but not just adding them to the list and piles of strategies and plans that we already in Jordan excel at doing, but being able then to implement them and be able to monitor them and make sure that we are getting the right impact. And that's something we fail to do. It needs to have financial resources. And in Jordan, we do have the resources, but are we putting them in the right place? And are we spending them correctly? And are we monitoring that or not? And are we preventing duplication or not? And that is important. The other thing is we need to have data. In Jordan, we really don't have enough data. Or if the data that we see, the majority of it comes from the Ministry of Health. Maybe from the Royal Medical Services, maybe from UNRWA, but we don't have national data. I think the only number that we have at the moment is the maternal mortality number, because it's a national number. And that's very sad. The other thing is that we need to have the proper human resources who are qualified, who have the right attitude and skills to be able to provide care, and they are fairly distributed. And that's one big complaint in Jordan, is the unfair distribution of health resources. Research and innovation, and you've had 2 days of talking about research related to nutrition. We need to have the proper infrastructure in our centers where women can be counseled in privacy, where women can breastfeed their children in a place that is private and she can care for her baby while she's waiting to be seen. All of these have to be in place. An educational system that nurtures healthy lifestyles, physical activity, proper nutrition. And somebody was talking today about a social protection network. That is very much important for us. And you remember that became very important during COVID. And focusing on primary health care, only 17% of our health budget goes to primary health care. So this is a very clear message. Where is the importance, primary health care or secondary health care? And we need to focus on the media, and we see that importance now, and also the role of civil society. So I would like to thank you for listening to me. I hope that this presentation just gave you food for thought, and I really was impressed by all the research that I heard today, and I wish you the best of luck. Thank you.